Now we're going to talk about I'm going to compare the, let's say, different causes of transient loss of consciousness. Okay, so it's going to be a big table in a way, or a scheme. Transient loss of consciousness, okay? Or you can write it as this. And this is a pretty nice rule for you. So basically, you always look how it started. And if someone, so this is when someone faints or loses consciousness, okay? Or whatever, it's the same. So basically, very simple. If first, like let's say if the loss of consciousness, it's gradual in a way, so that he feels dizzy, not so well, and goes deeper and slower. Now he falls into let's say he loses consciousness, but it's gradual in a way, not very fast, gradual. Rather, you will think of this as a metabolic problem, okay? Yeah. So in general, we're talking about general causes of loss of consciousness. If it's metabolic or toxic cause, so over here it could be, for example, hypoglycemia, but not hypoglycemia that triggers seizure. Watch out! I'm gonna talk about seizures over here. They're different. So if it's just a hypoglycemia when someone falls into coma without a seizure, then it's rather gradual, okay? It's sort of like he slips into it, okay? It's not instant, yeah? So if someone like slides into he loses consciousness more and more and more, and then he's off, then you would rather think of some kind of metabolic problem or intoxication by something. This is a general rule. Of course, there are exceptions. Don't forget that. But you can look at it like this, okay? And basically now I'm giving you a manual. If someone comes to your office and now he says, well, I felt bad, and then they were telling me I sort of felt bad, worse and worse, then I fainted, you should think of rather this. So we will ask, are you taking insulin or something, okay? So, or did you eat something or whatever. In contrast to this, if we forget that, then what is very important is if he falls into coma very fast or pretty fast, instantly in a way, instant, or very fast, okay, fast. Basically, you will rather think of two main things. Okay, and either it's syncope, as it is, and very important in syncope, typically, what is important is that this person regains full consciousness instantly as well, very fast. So he faints in a way, and wake up, and he's oriented immediately. This is totally different than, remember when you saw the grand mal seizure, how the woman was like disoriented or whatever, yeah? So in case of syncope, it's like faint, wakes up, knows who he is, where he is, only it's not remembering the actual moment when the person fainted. So that's syncope, that's important, okay? So regains full consciousness, fast, okay? Yep. So this would be syncope. Regains very fast, it's syncope. Watch out. They are different. You saw there were different types of seizure. And these sort of didn't, or like they regained the consciousness very fast, and those were the, let's say, partial seizures. Okay, but now we're talking about the real grand mal seizures, and I'm going to still tell you more later. But remember, if it's a epileptic seizure over here, and if it's a typical tonic-clonic seizure, grand mal, the regain of consciousness, it's slow orientation. Okay, so this one is fully oriented immediately. If it's a grand mal, it goes slow, like in 10 minutes, 15 minutes. That's very important. Okay, and there are other differences. I'm going to tell you that more. But now I want to focus on syncope, because syncope is also a question. So the syncope, there are many causes of syncope, but they have one common thing, and that is hyperperfusion. Syncope means that there is a hypoperfusion of brain. Okay, that's the main thing. Okay, so it's a hypoperfusion of a brain, and there are many causes. Okay, and what I want you to remember is syncope is a very, very important sign, because of one group of the causes of the syncope is very dangerous, and that is related to heart problems. Okay, so in case, and we should really stress this out, that the syncope could have a problem in heart, and when it's a cardiac syncope, and this is the one you never should underestimate, never ever. That's why basically you should never underestimate syncopes. Because if someone said, well, I'm 40 years and I suddenly fainted, and they're telling me, I don't remember that, but I fainted. First thing you're going to do, you check the heart. From today, remember, always, never, it's never okay to leave him alone, because he can have a serious heart problem, and this can happen again, and he can die. He can be driving something, or he can just won't wake up because he has a serious arrhythmia. So basically, if there is a sudden syncope and the person never had it before, that was the first time, always check the heart. Always, 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 never forget that. And what are you looking for is either arrhythmia, or some structural problem. There could be something with a valve. Okay, or aorta also, sort of, you put it there as well. Okay, so there could be dissection of aorta or something, but yeah, that would be much more serious. But anyway, first of all, remember arrhythmias. And it could be either tachyarrhythmia, so very fast one. So tachyarrhythmia. Why? Well, because if you have a ventricular fib, or not that would be too fast. No, he would die immediately. But if you have a VTach, then the diastolic end volume is going to be small and the cardiac output decreases. Okay, so the patient is having syncope, or it could be bradyarrhythmia, very slow. And remember, especially in these cases, remember three things, or maybe two: sick sinus syndrome and bradyarrhythmia. And also AV blocks. And why I meant three, because you can talk about AV blocks, second degree, second type, which is Mobitz 2, or AV block third degree. Over here they can go so slow that really they can faint. They're having a syncope. And you know what do you call these syncopes? Those that are caused by bradycardia and arrhythmia. That's Adam-Stokes. And Adam-Stokes syncope or syndrome is always, could be very dangerous. It's telling you, watch the heart, okay? Yeah? So cardiac syncope, and it could be also, as I said, MI or whatever, but yeah, just that the cardiac output, every time the cardiac output decreases and the flow decreases, then you can have a syncope. Yeah. So you have to rule out the cardiac causes. Okay. Yeah. And then you have many other ones which you basically know. And by the way, the cardiac causes, they're like cardiac are like 15% of all the syncopes. Okay. And if I will get to the syncopes that are not heart related, that means that the heart is okay, like a pump. Pump is working fine, it's totally fine. So heart is okay. And there are other causes, typically reflexes, whatever. So over here you have many of them. And some you could have seen because they're pretty common. But remember, first of all, you rule out the heart, and still he had a syncope, and in 30 to 50%, you don't know the cause. You just know heart is okay, and you don't know what was that. And then the ones we know, and the most common one we know, it's the vasovagal reflex, or vasovagal. Okay, so vasovagal syncope is the most common one. It's 20%, and these are typically the young women that come from it's cold outside. They come inside. There's too hot, too humid, and now they faint. Okay, so basically it's a neurocardiogenic. It's because of some vasodilation. It's due to, let's say, neurovegetative lability. Okay, so neurovegetative lability. Neurovegetative lability. Yeah? Okay. So that's one of the causes of syncope, vasovagal syncope. The other one is orthostatic syncope. And this you will see very much, orthostatic syncope. And this one you're going to see very much in hospitals. This is typically when you lay down like 3 days, old patient, he lays down, his reflexes are turned off, and now you make him to stand up, and suddenly he faints because the heart is not able to cope with the hypotension, and they faint. Okay, so this is very typical. And remember, watch out every time patients after back surgery, whatever, they shouldn't lay so long, especially older ones, or even you. If you lay 3 days in a bed, you can have a orthostatic syncope when you stand up. So you can really you can hurt yourself, you can hit your head and whatever. Okay, so this is another one. Then you put in syncopes as well, because it's about perfusion of, let's say, part of the brain, and those are drop attacks. This is very much connected with vertebrobasillary system. Okay, we think it's vertebrobasillary system, and over here mostly we think that the patient, for example, turns his head, and because those are older patients, their let's say vertebra are not as good, and they could have osteophyte or whatever. And with this rotation of the head, they will compress the vertebral artery. And now there is a hypoperfusion of the brainstem, and that's why they fall down. Okay, so those are, hypoperfusion brainstem. Okay, I will draw a brainstem over here. Yeah, so it has to do with the brainstem hypoperfusion. Those are the drop attacks. Okay, and then still you have situational one. Situational syncope. This is typically with Valsalva, and I will actually Valsalva maneuver. If you use it too much, it can be so strong, or sometimes due to coughing, that they so much decrease the return of the blood to the heart that then you are hypotensive in carotids and in aorta, and again you can faint. You can have a syncope. So that's this, and still there is one more maybe to vasovagal syncope, and it's connected. So I said these are girls, but also men. Typically, it's called micturition. syncope. Typically, if you're drunk, you know, women are typically sitting, but men typically are not. And when they're drunk, and now it's in the night and they go to a restroom, they can faint over there. And it's a special type of vasovagal syncope. Okay. So as you can see, here are many, I gave you many examples of syncopes. Okay. But mainly you should know the vasovagal one, vasovagal, and the orthostatic. Okay. Maybe there's still one more. I can still give you one more. And this can happen to you when you're older, typically, and you have more sensitive carotid sinus. It's the carotid sinus syncope, syncope of the carotid sinus, or sinus caroticus, sinus. And this is typically when you're having a shirt or something, you tied it up too much, and you can stimulate it so much that the patient faints. Or it could be due to seat belts, you know, which are, compressing your neck. Or it could be during shaving, okay? So sometimes these people faint. So it's due to the carotid sinus stimulation, okay? So that's another type of syncope. So basically I named almost all of the types of syncopes you can have over here, yeah? So, but over here again, remember, if it's, so these are the examples of transient loss of consciousness. All of these are sort of fine. It's just a reflex or something like by a trigger. This is the most dangerous. If someone has arrhythmia, he can die, okay? So watch out for the syncopes due to heart, so cardiac syncopes, yeah? And these are like gradual, so metabolic and toxic, okay? So still, metabolic and toxic gradually faint. Over here, it's rather instant fainting, and either it's syncope, it's like all these kinds of syncopes you can have, so it's only about perfusion of the brain, or it could be an epileptic seizure, the generalized one, the tonic-clonic seizure, yeah? Good. So, thanks for watching, and don't forget to subscribe and ring that bell. And as always, check the description below for supplementary questions and other materials.